Good afternoon. My name is Daniel V. Rutkowski. I'm a practicing nurse practitioner at Beaver County Pathways Mental Health and Wellness Clinic in Ambridge, Pennsylvania. Ambridge is in the county of Beaver, which is about 20 miles north of the city of Pittsburgh, and is a small bucolic former industrial town alongside the Ohio River. I have been working in psychiatric nursing for nearly 14 years. I have experienced the psychiatric component of many people across a large lifespan, from small children in a residential facility that catered to children with many unfortunate backgrounds. I've worked in inpatient, outpatient, community treatment, and most recently as a nurse practitioner in outpatient doing medication management and intake evaluations. One prevailing common thread that presents most often is the patient with suicidal ideation. Ambridge, once again, was a thriving river town, predominantly due to the massive presence of the steel industry. The area subsequently and unfortunately has become a hub of co-occurring demographics. As such, with the stressors of the pandemic that we are currently experiencing worldwide, much too often, suicide is often seen as the only solution by many individuals. This presentation of my scholarly project that I have created will attempt to utilize a new and validated screening instrument to see if suicidal ideation detection rates can be increased. Currently, suicide is the 10th leading cause of death in the United States, with numbers such as 45 million people being diagnosed, which is a key factor, being diagnosed, having a mental illness, whereas 11 million of those are considered to be serious. If we consider the age demographic of 10 to 34 years of age, the incidence of suicide skyrockets to the number 2 position. With a ongoing and sustained global incidence rate of approximately 800,000 completed suicides annually, one can see why any steps to abrogate this disease process in any manner would be a worthwhile endeavor. Once again, the numbers that we consider with suicidal completion rates is truly of pandemic proportions. There is a similar death rate from suicide than the current COVID pandemic. It is unfortunate that due to the insidious nature and oftentimes the stigma of suicide, that it should not be considered at least equal to, if not more, of a public health pandemic than COVID or other similar prior pandemics. What nurses need to be cognizant of are their place where they are often the first to engage with a patient that might have suicidal ideation. There are very few disciplines, if any, where the nurse does not have ample opportunity to utilize listening and critical thinking skills along with a validated screening tool that will help detect the potential for suicide. This project will, again, was intended to increase the awareness of suicidal ideation, utilizing a new and validated screening instrument that was not previously employed at the mental health clinic. There are very few circumstances where nurses are not engaged with the patient who has suicidal ideation. As can be seen here under the suicide warning signs, oftentimes it can be quite subtle, and these instances need to be assessed by an in-tune nurse with adequate skill and training. There are oftentimes very subtle things that patients will state, such as, having no reason to live, killing themselves. If you look through their moods, a lot of times these are basic normal human emotions, but we need to be aware of what's going on behind the scenes in the patient's manner of thinking. Some of the behaviors stand out, such as you notice an increased use of alcohol or drugs, withdrawing from activities, isolating from family. Sleeping too much or too little is oftentimes a key. This is a big one that isn't often talked about, is giving away prized possessions and aggression. The strengths that this research project has shown was that there is a very urgent need to develop suicidal ideation screening instruments. These tools are in great need, again, to formulate some type of abatement program. Many screening interventions are available to be utilized for suicidal ideation detection. But a great weakness that the author perceived was that many of the instruments seem to have little to no correlation with each other. They seem to ask the same questions over and over, just worded differently at times. Also, often I noticed that many depression screening instruments were being used to assess suicidal ideation. For example, prior to starting my research project at the mental health clinic, there was a questionnaire that was submitted to patients to assess for suicidal ideation. The one that was utilized was the Patient Health Questionnaire, otherwise known as the PHQ-9. This is a very well done and in-depth questionnaire. However, most of the questions revolved around depressive symptoms, with only one being asked that if there is any type of active suicidal ideation. Therefore, this instrument is more appropriate as a depression screening than to assess current suicidal ideation. A gap or another weakness that was quite astonishing to me was finding that there are detractors to the screening process in and of itself. Again, surprisingly, the USPTF, the United States Preventative Task Force, does not even require primary screening in any primary healthcare setting. The methodology and design of this research project was a quantitative exploratory design. It began with a retrospective chart review. A design and implementation screening parameters were put into place, and the implementation of the new and validated screening instrument, Ask Suicide Screening Questions, or ASQ, was the chosen instrument to be utilized. ASQ screening instrument was chosen in part because of its pedigree as being recommended by the National Institute of Mental Health, and the definition of its inclusion parameters closely associated with the goals of this scholarly project. Design component of this project. The resources that were necessary to implement this procedure were defined. The budget was also defined, and it was at the end a very cost-effective, or perhaps even Spartan, as few resources were required to put this project together. Basically, it was just some time, paper, office supplies, etc., were the only necessary monetary components. Human subject protections, of course, were always paramount during the research project, and the protection of data that was acquired was handled with the utmost protection of data, period. For example, of course, the human subject protections were incorporated, and the assurance of inviolable protection of data was accomplished via shredding of any documents. The analysis component of this project started with 250 patients from a pre-implementation pool of candidates. After a discussion with Dr. Mark Pauls of Maryville University and using a power analysis, it was determined that at least 100 patients would provide a adequate sample size. Subsequently, 114 subjects were vetted to be validated participants in the research project. As can be observed here, during the pre-implementation phase, 19 of 114 validated patients via the chart review showed a suicidal ideation detection rate of 17%. However, after the implementation of the validated screening instrument, 29 out of 114 patients polled showed a 25% detection rate. It was indeed satisfying to see that of the 29 of 114 post-implementation subjects showing an 8% increase, meaning that, if nothing else, this small sample size showed a clinical significance. Through the recommendation of Dr. Pauls, an upper tail z-test for the difference of two proportions was utilized. Interestingly, the p-value that was obtained after statistical analysis using the IBM statistical software SPSS, the p-value was 0.0521. Of course, any p-value of over 0.05 indicates that the result is not statistically significant, and therefore the null hypothesis cannot be rejected. In conclusion, with approximately 800,000 deaths throughout the world due to suicide completion, the answer is quite clear. There must be a better way of detecting suicidal ideation. Overwhelming evidence shows that appropriate screening can increase detection rates. It was uplifting again to see that something so simple and easy to apply can and does increase the detection rate as indicated by the clinical significance found in this research project. This researcher feels that with a larger sample size and perhaps a more demographically diverse questionnaire, a statistical relevance can be achieved. This researcher also feels that due to these considerations, this research project is ideal for further study. I appreciate you taking the time to consider this presentation. It has been my honor and privilege to present it to you. If there are any questions or concerns that you have right now, I would be more than happy to answer any of them to the best of my ability. Thank you again for your attention to this very important disease process.